welcome back to our Wellness Wednesday webinar. I know the whole world is busy preparing for the Christmas Eve, but before we are going to be busy, we have some topics that we have to discuss that is about emergency for immediate care. So, our in house speaker is from the clinic team. So, she's a licensed physical therapist and she's with the company or she's with the team for 9 months and counting. Aside from being a PT, she has some exposure with the different emergency cases. So, let's welcome Rachel Lingan, RTRP.
Hello po, good morning. Hi guys, I'm Rachel, your physical therapist for today. I am here to share with you the immediate care for emergency care. Okay, let's start. It is important for us to know whether to go for the care that we need. For example, you having ankle sprain, bad colds, or chest pain. You must think, saan na ba tayo dapat pumunta? So, meron tayong three types of medical care facilities. First one is urgent care, second one is immediate care, and the third one is emergency care. Let's first know what is urgent care. Urgent care is a medical treatment or illnesses or injuries that require immediate attention but not life threatening. Usually urgent care facilities is usually attached or nearby hospital. One good example for urgent care is health centers. They usually open for weekdays. For the preceding slide, we will sharing the illnesses that would be under urgent care. The first one is fever. What is fever? Fever is a body temperature that is higher than normal. What is our normal temperature? Normal temperature is 36.5 degrees Celsius to 37.5 degrees Celsius. Usually, fever it is a sign that your body is trying to fight an illness or infection. We will share some home remedies for fever. Home remedies. First thing is, syempre, inom tayo ng maraming tubig. By drinking plenty of water, yung mga nawala nating fluid, kasi kapag nagkakaroon tayong fever, may tendency na ma-dehydrate tayo. Ang need natin talaga is uminom ng maraming tubig, juices, or broth. Next thing is rest. Usually, we need talagang mag-rest to, syempre, to recover. Then, an activity can raise your body temperature. Then, the last one, and stay cool. To stay cool, syempre, you need to wear something na comfortable kayo. Then, yung room temperature natin, dapat cool lang din. Then, you must use a sheet or light blanket. Usually, yung iba iniisip nila kapag mas pinapawisan sila, mas bumababa yung fever. Ang ginagawa nila is gumagamit sila ng mas makapal na blanket. Dapat ang gagamitin lang natin is yung sakto lang. Hindi masyado tayong na cover. I mean, hindi masyadong nako-close yung init. Dapat nag-ano lang siya, nagsi-circulate lang siya, hindi lang dun sa isang part na yun para lumalabas din yung init natin sa katawan. For the next slide, ear infection. Ear infection are common cause of ear aches or ear pain. Ear infection can occur in outer, middle, inner ear. Outer ear infection can be caused by swimming, wearing hearing aids, or headphones. Outer ear infection yun. For the middle ear infection can be caused by infection that stem from respiratory tract infection. Here are some remedies for ear infection or ear pain. For ear pain, you can apply a cold washcloth to the ear, then avoid getting the ear wet. Then sit upright to help relieve pressure. Usually, kapag mayroon tayong ear pain, ang tendency ginagawa natin, nagla-lie down lang tayo, higa ng ganyan. Ang mali pala yun. Dapat ang gawin natin is sit upright tayo. Pwede rin naman kumuha ka ng pillow, then mag-lean forward ka para yung pressure is, yun nga, madidecrease sa ear natin para hindi siya magdadagdag or mag-aggravate pa yung pain na na-experience natin. Then, usually, pwede rin natin gamitin yung over-the-counter ear drops. Bumibili naman yun. Then, take OTC or over-the-counter pain relievers. Then chew gum to help relieve pressure. So by chewing a gum, nakaka-relieve siya ay nakaka-decrease niya yung pressure na naramdaman natin sa ear natin. So by there, so magde-decrease din yung pain na na-experience natin. Kasi may tendency kapag tumataas pa yung pressure sa ear natin, mas tumataas yung pain na na-experience natin. So by the next illness, so sore throat. So ano ba yung sore throat? Sore throat is a painful, dry, or scratchy feeling in the throat. So, ano yung mga home remedies na puwede nating gawin? So, siyempre 'pag nagkaka-sore throat tayo, need natin talaga yung mag-rest. So, if mano-notice mo kapag nagpupuyat ka, nagkakaroon ka rin ng sore throat. So, ibig sabihin lang yun, need natin mag-rest, yun number one. Then number two is drink fluid. So, na may tendency na yung throat natin is nagda-dry, kaya minsan nagkakaroon siya ng soreness. So, kailangan natin talaga uminom ng maraming tubig. Then try comforting foods and beverages. Gargle with salt water. So, bakit daw salt water? Yung salt water kasi, 'di ba kapag ang salt ano siya, nag-a-attract siya ng more water. So, kung magga-gargle ka ng ka ng salt water, so kasi nga 'di ba 'pag nagkakaroon tayong sore throat, may tendency na nagda-dry. So, kapag naggargle tayo nun puwedeng mag-ano siya, mag-ano pa ng maraming tubig. So, hindi na magda-dry yung throat natin. So, humidify the air. So, kailangan natin yun. Then consider lozenges or hard candy. So, yun yung mga puwede nating gawin para ma-relieve yung sore throat natin. Then avoid irritants. So, ano ba yung puwedeng mga irritants? So, mga something sweet na kinakain natin. So, 'wag na nating gawin muna for the meantime. Then for the next illnesses, so cough. What is cough? So cough is your body way of responding when something irritates your throats or airway. So ito, tendency natin kapag merong nakabara sa atin, tendency para ma-relieve yun, nagka-cough tayo. Puwedeng cause ng cough, puwedeng meron tayong colds, puwede yung mga tendency ay yung mga causes niya. So ano ba yung home remedies na maibibigay natin? So use cough drops or hard candy. So, puwede 'yun para kahit papaano yung ano natin is maging okay. Then, try teaspoon of honey. So, according sa research, nakakatulong yung honey to to relieve yung cough natin. So, para mapabilis yung recovery for cough. Then, drink up. So, yung drink up natin siyempre 'wag na tayo masyadong mag-cold. So, ang inumin natin is warm water. Then heat up that drink. So yun nga. So dapat mainit yung something cold na iinumin natin. Then cough medicine kung binigyan tayo ng gamot ni doktor. So follow natin yon kung ano yung dosage niya, then yung frequency ng pag-inom dapat i-follow natin. Use decongestant. So decongestant. So usually kapag nagkakaroon tayo ng cough, yung daanan, yung throat natin is masikip. So, congested. So, use natin ng decongestant para yung airway natin, so magiging, kumbaga dati masikip, so magkakaroon ng konting kaluwag-luwag dun sa throat natin. So, breathe in steam. So, kailangan, syempre, moist yung dadaanan natin, na idadaanan ng hangin natin. So, vomiting. So, vomiting or throwing up is a forceful discharge of the stomach content. So, usually ba 'pag nagva-vomit tayo, ano bang mga reason ba't tayo nagva-vomit? So may iba, yung iba minsan yung iba buntis, yung iba naman may problem, may hyperacidity, meron silang GERD. So ano ba yung mga remedies na puwede nating ibigay? So drink a clear or ice cold drinks, then eat light bland foods such as saltine, crackers, or plain bread. So usually puwede nating kainin talaga is usually na nire-recommend natin is yung magbaon tayo ng crackers para may makakain tayo. So why crackers yung puwede nating ano, kasi yung crackers yun sina-satisfy niya yung hunger natin, pero siyempre ang pinagkaiba niya sa ibang food na napapansin natin na puwede nating kainin, puwede mag-satisfy ng hunger natin, yung smell niya kasi hindi masyadong attractive. Kumbaga hindi mas ma-a-attract na mag-vomit tayo. Kasi may iba na 'pag naamoy yung pagkain na 'to, ang tendency na mag-vomit lalo. So yun, kaya mas prefer natin yung mga crackers na lang. So siyempre avoid natin yung fried, greasy, or sweet foods. kasi mas makakapagdagdag siya sa pag-vomit natin. And siyempre, it's slowly and it's smaller and more frequent of meals. For ano naman, for 'yan nga, it's slowly talaga. Kasi 'di ba 'pag minsan nagmamadali tayo, 'di masyadong nagda-digest yung food, 'di masyadong napa-pound kumbaga, nahahati in small pieces. So, may tendency na 'di ma-digest siya na maayos. So, ang nangyari, nag nag-aano siya, parang nagba-bounce back papalabas sa'tin. So, may tendency tayong mag-vomit. Then, do not mix hot and cold foods. Then, drink beverages slowly. Yung mga puwede nating example nito yung mga umiinom ng mga alak. So, siyempre slowly lang din kasi may tendency na yun nga, mag-trigger yung pag-vomit natin. Then, avoid activity after eating. Siyempre hindi pa masyadong nagda-digest yung food na kinain natin. Puwede rin siyang yun mag-bounce back siya. Then, magte-tendency na magkaroon tayo ng ano yung vomiting. Then, avoid brushing your teeth after eating. So, bakit daw i-avoid natin yung pag-brush ng teeth natin after eating? So, may tendency 'pag nagpa-vomit tayo, may hyperacidity tayong tinatawag. So, yung acid na yun, napupunta dumadaan yun sa throat natin, sa mouth natin, and minsan nagre-remain sa teeth natin. So, pagkatapos mo kumain, kung puwede ka naman magmumog muna, then after an hour puwede ka ng mag-brush ng teeth. Sabi daw kasi, may tendency na naiiwan yung acidity natin dun sa part ng teeth natin, yung enamel, na nagko-cause ng decaying ng teeth natin. So ayun lang, wag ka munang kung masyado kang OC sa katawan, especially sa yun, sa mouth area natin. So, puwede ka naman mag-ano, mumog muna, gargle muna tayo, then after an hour, dun ka na mag-brush ng teeth. Choose food from all the food group as you can tolerate them to get adequate nutrition. So, yun. So, for follow natin yung home remedy. So, best yun to, ayan, if ever na ma-experience mo yung pag-vomit. So, for the next illness that we have for under urgent care, so diarrhea or diarrhea is loose watery stool or bowel movement. So, ano yung pwede nating remedies? So, liquids. So, bakit natin mag-drink ng maraming tubig? So, usually kapag ganyan na may tendency tayo ma-dehydrate. So, hindi natin mag-replenish uli ng maraming tubig sa katawan natin kasi marami tayong nilalabas that time. So, mauubusan tayo ng tubig. Then, add semi-solid or low-fiber foods gradually. So, ayun usually talaga na recommended na food kapag meron kang diarrhea. Then, avoid certain foods. Ano yung mga yon? So, mga oily foods na pwede, man sweet foods, wag mo na yon. Then, ask about anti-diarrheal medication. So, may mga nabibili naman na anti-diarrheal medication over the counter o kung may prescribe si doctor sa'yo, mas better yun eh, sundin natin. Then, pwede rin natin uminom ng probiotics. So, for the next illnesses, so urinary tract infection. So, what is urinary tract infection? So, UTIs are common infection that happen when bacteria are often from the skin or rectum enter the urethra and infect the urinary tract. For home remedies for urinary tract infection is wipe from the front of your body to the back after the bowel movement. Cleanse with soap and water if possible. So, as you can see naman, then kailangan talaga yung proper hygiene after natin mag-defecate. Then, wear white cotton underwear, shower regularly, and keep good hygiene. Kasi kapag mas clean tayo, syempre ma-prevent natin yung infection na magkaroon tayo nun. Do not wear tight fitting pants or pantyhose if possible. So, bakit daw need natin na i-avoid natin yung pagsuot ng tight fitting pants. So, sabi kasi, tight clothing po is can trap the moisture that created the bacteria to parang ina-attack niya yung bacteria mas lalo. So, avoid natin yung pagsuot ng fitting pants para hindi niya ma-trap yung mga moisture. Then take shower instead of bathing in the bathtub. So, sa tingin niyo bakit need natin mag-shower na lang instead of taking a bath. So 'pag nag-sho-shower tayo, tendency yung mga yung mga bacteria or meron tayo nade-drain agad. While in bathtub, so yung water na ginagamit na stuck doon. So yung germs nagro-roam around lang dun sa area. So may possibility na pumasok sa'tin or ma-infect tayo. So avoid creams, lotion, and feminine spray or oils near your genital area. May iba kasi na yun, masyadong conscious na ang mas better para mas maging clean yung genital area natin, ano lang 'to, water lang talaga yung pang-ano natin din, soap lang para mas okey. Kasi eto yung ibang chemical hindi natin sure kung ano ba siya, okey pa ba sa'tin or hindi na. Then empty your bladder often. Do not wait to go to the bathroom if you feel urge. So, usually yung iba ito yung mga ano, common causes din, yun. 'Wag mo nang hintayin na maiihi ka na, dapat kung nararamdaman mo na iihi ka na, go to the bathroom immediately na talaga. So, fluid. So, keep yourself well hydrated when sign of kidney problems are present. Yun, sabi ko nga kanina, so kailangan talaga hydrated tayo. Ayun yung pinakaimportante sa'tin to prevent many diseases. So, as you can hear naman maraming illnesses na need na need natin na ma-hydrate talaga. So, cranberry and blueberry juices had been proven to decrease incident of urinary tract infection, increase the amount of fresh food, vegetable, and fiber in your diet, and avoid excess fat, sugar, and red meat. Medication as directed by the doctor. So, yun, follow natin yung doctor kung ano yung binigay sa atin. Siyempre, kapag nagkaroon tayo ng, I mean, failure to follow the instruction ni doctor, siyempre, ang mangyayari nun, yung pag-progress natin dun sa sakit natin, siyempre, hindi rin ganun kaganda. Yun yung prognosis natin. Puncture wounds and laceration. So, laceration is a wound that is produced by tearing of soft body tissue. So, as you can see dun sa picture natin, so laceration, ito yung itsura niya. So, as you can see yun, yung tearing of body tissue, while yung puncture naman is a straight cut na parang something na penetrate yung skin natin. So, ano ba yung pwede nating home remedies for puncture wounds and laceration? Okay. So, first one is wash your hands. So, to prevent infection, kailangan talaga natin mag-wash ng hands natin. Then, stop bleeding. So, stop bleeding by putting pressure with using a clean cloth dun sa wound natin. Then, clean the wound. So, you can clean the wound by 5 minutes to 10 minutes by applying, yun nga, clean water din. Then, apply antibiotic. So, yun, kung antibiotic na meron tayo for the wound, kasama na rin siya dun sa pag-healing process. So, makatulong siya. Then, cover the wound. So, why do we need to cover the wound? Siyempre, to prevent the infection. Change the dressing. So, merong time yun na magpapalit tayo ng dressing. So, if ever na makita mo yung mga discharge na, siyempre kailangan na nating i-wound. Tsaka if ever na dirty na yung ano natin, yung pagka-dressing ng wound natin, papalitan natin. Then, siyempre, watch for sign of infection. Kasi, sign of infection, pwedeng mag-lead yun to emergency care na. Lagi nating i-monitor kung mayroong mga ganyan, sign of infection. Kasi pwedeng ano yun, magkaroon ng another symptoms pa. Pwedeng magkaroon kang fever or iba pang symptoms for infection. Kasi, ano yun, pwede mag-lead siya sa emergency care. So, minor burn. So, it involves the top layer of the skin. So, for minor burn, so, here are some remedies. So, kapag nagkaroon ka ng burn, so, minor nga lang siya. So, cold the burn. So, hindi mo need na applyan agad pag sinabing cold, hindi agad applyan ng ice, ganun. So, for cold the burn, pwede yung tap water lang. So, running water. I-ano mo lang yung burn na area. Then, after that, syempre, patuyuin mo siya pero 'pag nag-ano ka lang is damp lang. Then apply petroleum 2 to 3 times daily. Then syempre cover the burn with non-stick sterile bandages. So, but need pa rin natin uli i-cover yung burn area. If ever magkaroon yan ng blister, yun, para ma-prevent natin yung infection. Then, for pain naman, syempre painful yun. So, pwede tayong uminom ng over-the-counter drugs for, ayun, pain reliever lang din. Then, the air, protect the area from the sun. Syempre, na-burn na nga siya, kung hindi pa natin ipoprotect sa sun, so, may tendency mas lalong ma-burn siya. So that's all for today. So I hope you learned something for urgent care.
Okay, thank you so much for that, Rachel. I know some of you here was able to get some tips on how
Mm-mm,
to give immediate care whenever you encounter those type of illnesses or complaints to your
mm-mm.
family. So, do you have any questions or clarifications? So if you don't have any questions, so you can reach out to our clinic team, or you can just dial 420, or you can send us a message to our APOSI clinic team Skype account. So for the next topic, that would be the episode 2 of our emergency immediate care. So stay tuned, guys. Thank you for your time, and thank you also, Rachel. Bye.